Thank you, everybody, for being here. Thank you for joining me for this inaugural webinar for our new platform, DentFlix. We are starting 2026 with the most important shift in our profession's history. We- 4 years, 4 years, we've talked about digital dentistry as a set of tools, scanners, printers, and software. But today, we are talking about tools of dental intelligence. Today, I'm going to show you how to integrate AI and digital protocols to make your practice faster, more predictable, and frankly, more enjoyable. So let's dive straight in. Okay. Look back 5 years. In 2020, if you wanted to do a digital case, you scanned, manually merged files, and spent 30 minutes clicking points on a screen. Okay? That was manual digital. It was often slower than the analog way. In 2026, this landscape has changed. We now have unified data. Our software doesn't just store pictures, it understands anatomy. The efficient gap between those using AI and those still doing manual digital is now the difference between a profitable clinic and one that is struggling with overhead. Today is about closing that gap. Okay? So before we go further, we must address the fear in the room. AI does not replace your clinical judgment. It supports it. It isn't a robot taking your chair. It's a silent assistant that never gets tired and never misses a pixel. So whether you are a solo practitioner or a multi-location DSO, AI is the tool that levels the playing field by improving consistency across every diagnosis. So by the time we finish today, we will have a structured understanding of the intelligent workflow. We are going to focus on real-world applications, not theory. I want you to walk away knowing exactly where AI adds value to your bottom line and your clinical peace of mind. And I'll provide a 90-day roadmap to help you get there. Okay? So we have to master the 5 pillars of integrated workflow, identify where it helps us, implement it, and then achieve the efficiency dividend, which is our ROI, return of investment of what we did. Good. We've moved through 3 phases. First, we just replaced PVS with scanners. So from analog, we went to digital impressions. Okay, that's phase 1. Then we started connecting those scanners to 3D printers. Now, in phase 3, the software interprets the data for us. We have shifted from tools to systems. In this intelligent phase, the software helps us see the problems before we even pick up a handpiece. It helps us. Before we look at the tech, we must look at the architecture. I break the modern workflow into 5 pillars. First, we capture intraoral scanning, CBCT, face, AI input. Okay? Not just the teeth, but the bone and the face. Then second, we analyze using AI to find what the human eye misses. Then third, we plan. We plan on digital twin, a virtual version of your patient. So we make a virtual version of the patient, and there we plan everything. Then fourth, we create, choosing the right material for the right machine. So AI optimized CAD/CAM and 3D printing. And finally, we execute. If any of these pillars are weak, the whole case collapses. Today, we focus heavily on pillars 2, analyzing, and pillar 3, planning, okay, where the intelligence happens, okay? Good. Pillar 1. AI is powerful, but it isn't magic. It cannot see through blood. So it cannot fix a distorted scan. High-quality data acquisition is still the foundation. Standardized photos and clean scans remain essential. If you give the AI poor data, it will give you a confidently incorrect diagnosis. Quality is the prerequisite of intelligence. So if you give the AI garbage, you will get garbage. Okay. So let's talk about our biggest weakness, decision fatigue. So by 4 p.m. or 5 p.m. or 6 p.m., after seeing 15 patients, our ability to spot a tiny interproximal shadow on a bite wing drops significantly. So that's not what I say, that's scientific. AI doesn't have a 4 p.m. Using CNNs, convolutional neuronal networks, modern AI software like Pearl or Overjet, these softwares are available in the market, okay, analyzes every pixel. The data is clear. AI detection sensitivity is near perfect, while we, as humans, fluctuate. We have a 4 p.m., 5 p.m., or 6 p.m. time, you know? So it serves as a second set of eyes. AI serves as a second set of eyes, highlighting caries, bone loss, and pathologies. But more importantly, it changes the chemistry of the consultation. And here's the real practice builder. Okay? Listen up. Objectivity. So when you show a patient a bite wing and you say, there is a cavity here, you know what they hear, the patients? They hear a sales pitch that you want to sell them something. But when the AI highlights it in red and provides a probability score, like in percentage, you know, they see an objective diagnosis. It's no longer your opinion versus the patient's wallet. It is an objective medical fact. It changes the chemistry of the consultation from doctor versus patient to doctor and AI versus the disease. The biggest complaint I hear about digital dentistry is it takes too much time on the computer. AI has solved this. We now use automated segmentation. The software recognizes the mandibular nerve, the cortical bone, and each individual tool automatically. It used to take me 20 minutes, to segment a jaw for an implant guide. Now it takes 30 seconds. The AI does it for me. I practically, literally, I never have to correct anything on the AI right now. Furthermore, when we design a crown, the AI doesn't just pull a tooth from a library. It looks at the wear patterns of the remaining teeth So how do the remaining teeth look? How are they worn off or worn off? Okay. And then it generates a morphology that fits specifically to the patient's biology. We are no longer designers. We are editors of AI-generated excellence. This allows us to be clinicians again, not data entry clerks. Okay. So, predictive analytics and monitoring, the annual scan. That's our clinical baseline. We have to scan annually. In 2026, the most expensive thing in your office is a scan you didn't take. We must scan every patient every year to create a baseline. Why? Because of subtraction analysis. What's that? AI can overlay a scan from last year with one from today and generate a heat map. If the patient has lost 0.3 millimeters of enamel on the lingual of the tooth 1-1, for the US Americans that look here that are joining us, it's tooth number 8 in the universal system. Okay. Then the AI shows it in big, bright red. You don't have to guess if their bruxism is getting worse. You have the data. This moves us from reactive dentistry, fixing what is broken, to predictive dentistry, intervening before the cusp fractures. This is the ultimate tool for patient retention. So where will they go? You have their data. Of course, they can ask for the data and ask you to send that to the new dentist they go, but most of them don't do that. They just stay. Okay. Also, emotional smile design, digital DSD, digital smile design 2.0. Digital smile design has evolved. We used to spend an hour in Keynote or Photoshop at the very beginning of DSD. That is no longer happening at all. Now we use AI-driven 3D simulations. We take a 2D photo and the AI suggests a 3D tooth arrangement based on the patient's interpupillar line and lip dynamics. But the secret is the trial smile. We 3D print a mock-up for the patient, okay, from that AI design and put it in the patient's mouth. When the patient sees the new smile in 3D, not in a screen, but in their own mouth, the emotional connection is immediate. In 2026, this is our highest converting tool for aesthetic cases. What else can we do? Well, PFM is dead. Okay, material science is moving as fast as the software. PFM is effectively a museum piece now. We are choosing between monolithic zirconia for strength and lithium disilicate for aesthetics. But the disruptor of 2026 is permanent 3D printing resin. We are now seeing hybrid ceramic resin for 3D printers that are cleared for permanent crowns, not provisional crowns. While milling is still the gold standard for long-term wear, printing is catching up for short to medium-term restorations. Understanding the modulus of elasticity of these resins is key to avoiding debonding. But we are not there yet, so we cannot really print a final crown yet, but we are very, very, very near, and we are getting there. So the in-house lab revolution. So milling versus printing, which do you need? Do you need an in-house lab? Yes. But you don't need to be a technician. In 2026, the hybrid workflow is king. So you scan the patient, then you send the file to a design hub or an AI design service. They send back the file and you simply hit print or mill in your office. You retain the profit of the manufacturing, but you don't spend your night at the computer designing. This is how you scale the practice without scaling your stress. Okay, so you delegate the design and you retain the production. Scan, delegate design, make the production yourself. Modern CAD software now uses generative design. It doesn't just pull a tooth from a library, as I just said. It grows a crown proposal based on the patient's actual wear patterns. On the production side, AI optimizes our 3D printers, placing supports and nesting models to ensure zero failures. And keep an eye on permanent 3D resins. They are the disruptor of 2026. Okay, they will come better and will become better and better, and maybe in 2026 we really have permanent crowns with permanent 3D resins. Not yet there, but okay. Now let's get practical, okay? An AI is only as good as the data you give it. I said it before. Garbage in, garbage out. To get a zero adjustment crown, your scan must be perfect. In 2026, our scanners use AI to remove noise like the tongue or cheeks automatically. But they still can see through blood or saliva. So I still advocate for the double chord technique. So you use two chords, a 000 or 00 chord down there in the sulcus, and then a 1, 2, or 3 chord up. So the 1, 2, or 3 chord is there to expand the space and retract the gum. And the 00 or 000 chord down there is there to prevent fluids to flow so fast, and it retains them a little bit, okay? So if there is blood, it coagulates immediately on that 00 or 000 chord, and it clots a little bit the upcoming new blood. Not forever, just for a while, but we don't need so much time for a 3D scan. So that's our advantage then. Okay. We need to see the digital margin, 360 degrees of clear finish line. If the AI can't find the margin, it will guess. And that is where your fit issues begin. So if it guesses, then you have to work more. Spend 2 extra minutes on tissue management and you save 20 minutes at the delivery appointment. So finally, surgery. If you are placing implants with a guide, you are reducing risks. AI, nerve detection, and bone density mapping make guided surgery safer than ever. We can now go from scan to a 3D printed guide in about 30 minutes. It turns a stressful surgical hour into a predictable 15-minute clinical event. It isn't just about tech, it's about the standard of care. Well, let's talk about numbers. The ROI The return of investment of an AI integrated practice is undeniable. By printing your own guides, splints, and temporaries, your lab fees drop by half. By using AI diagnostics, your remakes drop by 80%. But the biggest ROI is time. When you move a case from 4 visits to 2, you double your hourly production. And, here you can see where all these data come from. They come from publications, they come from white papers, they come from outcome reports, and they come from clinical studies. So this is the ROI. I think Dr. Achnaf wanted me to make a 5 minute break, more or less after half an hour. I think now is a good time for that.
Yes.
Okay. And then we
And
later continue a little bit more. Okay.
thank you. I hope everybody is enjoying. If you are enjoying, say yes in the chat box. Karam, can you open the chat box now, please?
Can I write yes too?
Yes. Are you enjoying?
I am.
Me too. Yeah, thank you. Thank you very much. So far, we have 528, and I think it is the good time to announce our gift. We have uh, we have a very valuable gift, and it is very generous from Dr. Gomez. Actually, not only from us in DentFlix. First of all, I would like to announce the opening of the best platform, in my opinion, and I hope it will be the best in dental education, which is um, DentFlix. Let me share with you. Excuse me, Dr. Gomez. I would like to share this screen. Do you see my screen? Yes.
Yes.
Yeah. Okay. So, as you see, Dr. Gomez has so many courses online and offline. If you know Mastery Academy, he is teaching in Mastery Academy from 14 years in Dubai, Saudi Arabia, Qatar, Turkey, Spain, Italy, everywhere. And online also, because we are speaking about AI and new technology. Everybody now prefer to study online. And if you allow me, I will speak in Arabic because I think 95% of our attendees, or 99%, are Arabs. So if you allow me, I will speak in Arabic, then I will repeat in English.
Please.
يس دكتور جوميز هو طبعا من اهم السبيكرز بماستري اكاديمي، واليوم ماستري اكاديمي تعلن عن اطلاق منصة جديدة للتعليم الالكتروني في طب الاسنان. ان شاء الله ستكون افضل منصة في العالم، اسمها دنت فليكس. دنت فليكس. الهدية شو؟ الهدية هي هديتين. اول شيء لازم تعرفوا انه دكتور جوميز في عنده 4 كورسات قوية جدا، فيها 10th of hours، يعني مو ساعة ولا ساعتين ولا 3 ولا 4 ولا 10 ولا 20 ولا 30 ولا 50 ساعات من التعليم الأونلاين. وحدة منهم اسمها Dental Patient Communication، والثانية 20 Lessons in Dental Practice Management and Selling the Treatment Plan to Your Patients. في كتير كورسات للدكتور جوميز، هدول اللي هلأ موجودين، وإن شاء الله حيكون في كمان. وين الهدية؟ هديتين. الهدية رقم واحد إنه كل الناس اللي حضروا اليوم راح ياخدوا اشتراك مجاني في دنتفليكس لمدة شهر كامل. هذا الشهر الكامل إن شاء الله ستستمتعوا بهي الكورسات كلها مجانا، وفي غيرها طبعا. في لي كورس أيضا أنا على نفس المنصة، مودرن دنتال ماركتينج، وفي بالكلير الاينرز، وفي اشياء كتير موجودة على دنتفليكس. هاي كلياتها راح تاخدوها for 1 month for free. 1 month for free. وبعد ال1 month السربرايز الثاني second gift راح تكون في 50% ديسكاونت على الاشتراك السنوي. الاشتراك السنوي كله بعد الديسكاونت $299، يعني it's nothing. $299 per year annually. So it is nothing. It's less than $1 per day. And you get this information. And I think this is a very, very, very huge gift. And نرجو منكم الدعاء. نحن عندنا رسالة التعليم، رسالة نشر المعرفة. We have this mission, and we hope that you will get what you expect and more. And thank you. So how to get this gift? Here first, where is, you can scan. Yeah, you can take a photo if you want, or a screenshot for this QR code. And during this lecture, you will receive an email from DentFlix. It's written there, DentFlix exclusive gift for you. And this email is open for 24 hours only. So within 24 hours, you need to go and activate your gift. يعني لازم انت تفعل هديتك خلال يوم، خلال 24 ساعة رح يوصلك ايميل. واذا ما وصلك ايميل فيك هلا مباشرة تاخذ هذا الكيو ار كود وتدخل تسجل وتحصل مباشرة على الهدية تبعك، وتبدأ تفتح الكورسات اللي بدك اياها وتشوفها لمدة شهر مجانا، وبعد شهر 50% ديسكاونت، يعني $299 بالسنة كلها. So enjoy. And if you have any question, you can write to support@dentflix.academy. We will write that in the chat box. Support@dentflix.academy. Enjoy, enjoy, enjoy. If you have a question, just write it in the chat box. And at the end of this hour, we will present it to Dr. Gómez. Thank you. Thank you very much. Thank you. Write your questions. We will answer later. Dr. Gómez, you can start now.
Okay. Are they seeing my presentation now again, Dr. Muhammad?
I prefer that you... Do you see the presentation? Yes, I see your presentation. So
Okay.
I see the presentation.
Perfect. Good.
Please, I will send the link of the webinar of the gift here in messages also.
Okay, in the chat box. Thank
Okay.
you.
Okay. Perfect. Good. So let's continue. Because not all is magic. Okay. Things go wrong also, but most failures come from poor data at the start of uncalibrated 3D printers. You must have a digital champion in your stuff. So, someone who owns the maintenance of these machines, calibration, not only of the scanning machine, but also of the printers, okay? And remember, with all these datas, cybersecurity is now a clinical requirement. Protect your patient data as carefully as you protect their smiles. With great power comes great responsibility. You are legally and ethically responsible for every diagnosis. Transparency with the patient is key. Furthermore, with this much data, cybersecurity is now a clinical. Protect your patient's data. So you need external IT security when you start networking, sending data out to outsourced design services, to your labs, external labs, and so on. If you send all these data, it must be protected. It has to be crystal clear, okay? At this point in the webinar, I think most of you are convinced that digital dentistry and AI are important now. The real concern is how we execute that. Okay. How do we introduce these systems without slowing down the clinic, confusing the team, or creating more screen time for the dentist? So what I want to share now is a 90-day roadmap that has been tested in real clinical environments. It does not require closing your practice, hiring IT staff, or becoming software expert. It requires structure, sequencing, and leadership. So most digital projects fail. Why? Well, for predictable reasons. Clinics buy multiple systems at once, implement them in parallel, and assume the till will figure out how it works. Yeah, there is no clear owner, no standard protocol, and no timeline. That's why it fails. So AI does not fix this. In fact, AI makes chaos more visible. So this roadmap exists to remove randomness and replace it with intentional progression. So we have a logic of 3 phases while we implement the AI into our dental system. Okay? The logic of this roadmap is critical. First, we standardize how data is captured and stored. So we have to standardize. So this is how we take it. This is where we store it, how we store it, where is it, so that everybody knows. Okay. Then second, we introduce AI to support diagnostic and planning decisions. So AI is in the phase 1, not there. It starts to be implemented in phase 2 in our office. Okay. And third, we scale production and predictability. When clinics reverse this order, frustration is guaranteed. When they respect it, adoption becomes smooth. So phase 1, usually day 1 to 30. So we have a 90-day plan, and 30 days only to make a protocol, one standard, every patient. Okay? So first 30 days are about discipline, not technology, discipline. Every scan, every photo, every radiograph must follow the same protocol. The goal is not perfection, it is repeatability, so that everybody can do it, everybody can repeat it. AI does not need brilliance, it needs consistency. This phase also requires assisting a digital champion, someone responsible for data quality and protocol, okay? Compliance. When this role is clear, the digital dentistry stops being stressful. So you have to assign somebody who is the digital champion. The digital champion knows about the protocols, standardized, and what we do with every patient, where everything is stored, how it is stored, where you can access it, how you can send it out, where you can send it out. Is it is it compliant with the data security and so on? And this champion also makes sure the machines, that means intraoral scanners or printers, are maintained. Okay, standardized maintenance. I don't know. Every week we make the maintenance, or every 3 days, every 2 days, whatever. Okay, it depends on how many you have also. Okay. Then in the phase 2, we introduce AI, not to replace clinical judgment, but to support and validate it. AI provides consistent diagnostic support, regardless of fatigue or time pressure. AI, for example, like the software Pearl for radiographs, okay? But there are many, many other AI softwares that help you to design crowns, softwares that help you to design splints, okay, night guards, softwares that, well, different softwares, all based on AI, okay? So you introduce all these that you want to introduce in phase 2, when phase 1 is already crystal clear everything. Because it's not clear, then bad news for you, okay? Then AI provides consistent diagnostic support regardless of fatigue or time pressure. More importantly, it transforms patients' communication. When patients see objective, AI-supported visuals, the discussion shifts from opinion to shared understanding. Trust increases, and case acceptance follows naturally. Then in phase 3, the final phase, we start the production. We design smarter, produce faster, deliver confidentially. The final phase is where efficiency becomes visible. AI-assisted design reduces variability. Improved CAD/CAM and 3D printing workflows reduce remakes and chairside adjustments. Most successful clinics adopt a hybrid lab model. The design can be outsourced or AI-assisted, while production remains in-house. This protects margins, improves turnaround time, and reduces stress. So after 90 days, nothing feels dramatic, but everything feels easier. Appointments are calmer, decisions are clearer, and outcomes are more predictable. Technology enables possibilities. Systems sustain performance. Clinicians remain in control. AI is a co-pilot, not the pilot. You are the pilot. And when implemented correctly, it allows you to practice better dentistry with less friction. So the conclusion and the key take-home messages for you, okay? So if you remember only 3 things, first, it should be that the tool doesn't matter as much as the system. You have to set up a system. Remember, phase 1, standardize the scanning procedure, standardize how data are captured, where they're stored, how they are transferred to other places and everything, okay? Now, so a system, you need a system. Second, AI is your safety net against fatigue and oversight. So if you are not 100%, I would not say awake, but with power, okay? After a long working day, AI is there without any fatigue to help you to read better and interpret better a new radiograph that you just took, okay? It reduces the human error factor, okay? Nevertheless, it never replaces the human. And the third thing is the integration is where the profit and the joy in dentistry live, okay? Don't just buy technology. Build a workflow, use it, okay? I know a lot of dentists, they bought 3D printers and they never use it, not even to make models. They just don't use them, and they spend the money. So go through all these 3 phases and then use this AI help for you. Okay, good. Now we are at the end of the presentation, and I want to thank DentFlix and Mastery Academy and Dr. Ahna Valjaja for inviting me to share my vision on the digital technology and the AI in dentistry and what's coming. And I hope we soon can be able to print our own final crowns and not just mill them, okay, in our offices, which would be very nice.
Yeah, it will be nice also to print money.
Yeah. No, but of course,
No. This out of record.
Okay.
Thank
Good. I
you.
hand over to Dr. Ahnaf Al-Jaja, my good friend and
Thank you.
near soul.
Thank you. Thank you, Habibi. Thank you. Thank you very much. Shukran jazilan. Thank you. It was very wonderful lecture. And I hope you prepare for us a complete course about step by step each
Implementation.
device.
Yes.
Yes, how to use every device in the clinic, in everyday life.
It will be available at DentFlix in a few months. Yes.
Very good. Thank you. Thank you very much. And I will ask Dr. Muhammad if your mic is okay. You can
Yes.
deliver the questions to Dr. Gomez. But before that, I would like to answer one common question that 2 or 3 colleagues ask. Why the website is asking credit card if there is no payment? Okay, I will answer this in Arabic. أصدقائي زملائي زميلاتي الويب سايت ما راح يطلب منك تدفع أي شيء. الدفع بعد شهر، يعني بعد شهر إذا أنت ما كنسلت، إذا أنت مبسوط، بعد شهر الموقع حيسحب منك $299 after 1 month. مو هلأ ما حياخد منك شيء. ففي دكتورة قالت لي the gift is gift. Why you are asking for money? We are not asking for money first. Second, selling is not a bad thing. We maybe I will make a lecture about that one day. مو عيب انك تدفع فلوس عشان تتعلم. The lectures and the value of the information in the website, it values millions. So if you are not willing to spend $299 per year, that's less than 80 cents per day to learn, then even if you get the information, you will not get the value of it. You have to give something. To get something, you have to give something. So if you don't have Visa card, please write to us on support@dentflix.academy. If you are in Syria or Yemen or Sudan, where there is no bank, there is no credit card, just write to us on the email and we will solve your problem. We will find a way. So yes, there is scientific, not only business management, there is scientific, and there will be more scientific lectures on the platform. Libya also. Anywhere, if you face any technical problem, just write to us on support@dentflix.academy.
اوكي بليز
تمام.
دكتور ممكن اضيف لو في امكانيه لو حد عنده تكنيكال ايشو ياخد سكرين شوت بس ليها ويبعتها لنا على يعني في ضمن الايميل، يعني ده هيساعد علينا اكتر.
Send your question or the challenge or أي شيء بتواجهك، أي تحدي, any challenge you face, screenshot and email. Thank you very much. Now the questions and answers with Dr. Muhammad.
Okay, please, if anyone has a question, please send us in the chat box. And we have 2 questions for you, Dr. Gómez, please. Dr. Asher is asking which AI-supported apps are used for CBCT analysis, and if possible, please clarify how we perform CBCT analysis using AI.
Okay, VCT analysis is, for example, is PERM. Okay, an example. That's the AI that we use here. Usually, you just upload your STL file of the CBCT, okay, and then the AI analyzes everything. Usually it has a setup. So, for example, identify the mandibular nerve, identify cysts, identify decays, identify the angles, for example, angles for an orthodontic analysis. Okay, all these things can be asked for from the software. Okay, so you just have to buy the software or pay a monthly fee to the software. That's only one example that I told you, Pearl. Okay, there are many others. If you
Okay,
want
please.
to know more of them, please write me an email, and then I will be happily. You saw the email down in my presentation, info@smilevalentia.com, and I would happily give you some different options.
Okay. Someone is asking if it will help in endodontics only, also.
In endodontics, yes, because it identifies very, very small changes in the bone if you're not sure whether or not there is an infection already in the bone or the decay has penetrated until the nerve. The AI can give you percentages, objective percentages of of risks of being in the nerve or not the decay. So that's for sure where it can help.
Okay. Dr. Muhammad is asking, he didn't get the point regarding the retraction cord relation
Okay.
to scanning.
Okay, good. The AI, when you send to the AI a scan that where the margins are not perfect, okay? For example, because there was blood while you were scanning or a lot of saliva while you were scanning, okay? The AI until now is not able to see through the blood where the margin of your prep is. So you need to make sure while you take the scanning that the margin is perfectly visible. How do you make sure? Well, by reducing the risk of blood everywhere and taking away areas that are covered by gum, constantly covered, constantly, not noisingly. Noise means the tongue is there, but goes away, is there, goes away, is there. So while it goes away, the scanner gets some pictures of the area where the tongue is not there. So the AI can reproduce everything without any problem, knowing that, okay, on some pictures, the tongue is there, but that's a tongue and it's not a real thing, okay? But if blood is there the whole time, then the AI cannot see it. So that's why the suggestion is 2 chords. First chord, 000, down in the sulcus, and the aim of this first chord is to coagulate the blood and make a blood clot that shuts the new blood from coming up. Not forever, but for a short amount of time. And this short amount of time, we take advantage of and make the scanning, okay? And the second chord is a thicker chord, 1, 2, or 3, number 1, number 2, or number 3. And this chord should separate the gum from the margins that we have prepped. This second chord we take away just before we scan. It's the same procedure we use usually with the silicon impressions also. I hope I could make it clearer now.
Okay, thank you, Dr. Gomez. One of our colleagues is asking, is there any AI tool that help dentists in occlusion, like bite registration in CR?
Yes, for sure. The AI tools that usually are making crowns or usually are also integrated in the scanners, iTero, 3Shape. You see, I have my 5 p.m. right now. Uh, they can see when you make when you register the bite, they can exactly match where the occlusion is happening, and they can show you exactly with heat maps where do you have more occlusion and where you don't have. You can also take with your scanner a dynamic occlusion, protrusion, lateral occlusion, eccentric occlusions, okay? By moving while you scan, okay? Of course, you have to tell the software that you are now moving while scanning, okay? And then the AI calculates where everywhere it is touching more and less until it doesn't touch anymore. It helps you a lot, by the way. So it replaces completely the occlusion paper. And you have it in different colors.
Okay, thank you, doctor. And the next question, how AI can help us in periodontic?
In periodontic?
Yes.
Well, in periodontic, I'm not an expert in that. I'm very sorry.
Okay, thank you, doctor.
Maybe
You have to ask your
okay.
wife. You have to ask your wife.
Yeah, I have to ask my wife. My wife is periodontist. No, but I could imagine, okay? I could imagine that as replacing these prefabricated metal crowns where you reconstruct really destroyed the deciduous teeth by printed long-term provisionals, okay, that are white, by the way. So there I can see an area for periodontics. And of course, in AI, in radiograph interpretation, of course, AI can also help us in periodontics, not only in implant surgery.
Okay. So one of our colleagues is asking, now some dental devices are supported with AI. What's about the accuracy of these devices as rotary devices?
Okay, yeah. Okay. Where we can say definitely that we are nearly 100% perfect is in diagnostic devices, AI-supported diagnostic devices. There are some devices that where you just put on the tooth, it has lights, it has percussion, okay, and then it tells you how much the tooth is moving, is there a movement on the tooth, and it identifies cracks in the tooth, it identifies decays inside of the tooth. There we can say it's nearly 100% accurate. Now, the other thing is if we have AI assisted rotary systems, okay, there we still need the doctor to be there.
There is any software designing the procedures in AI?
Sorry, I didn't understand the question.
Someone is asking, is there any software for designing the prosthesis or fixed or partial in AI?
Yes, yes. There is AI software for that, and or you just send that to platforms where they design that for you. But usually the milling software or usually the printing software has AI incorporated, and this AI gives you yeah, a proposal of the design of the crown or the whole prosthesis, okay? And also where the teeth have the inclination of the teeth in the prosthesis, okay? And then you can print out the prosthesis 100%.
Okay. Are there any AI-based tools or technologies that help record and store dental bites for patients who have multiple bites in order to reduce confusion and errors for dental technicians? Dr. Kamar,
Bites?
yes, patients with multiple bites. Is there any tools to store to store these bytes and
Yeah, I'm not sure if I understood what you mean with bites, okay? If you say that a patient has not a centric occlusion, but has different ways to bite,
yes,
okay?
I think this is what
Okay. Then of course we can scan the patient in the different positions of the biting and compare them in the software. So, and then compare that to the in the future if that has changed. That's the only thing that I can tell you about these bytes.
okay. Dr. Sarah is asking, are there any AI prompt that can help us to enhance and perfect our clinical pictures and cases to make editing easier and more automatic?
Canva.
Okay.
Canva integrates AI tools that help us with that. Yeah.
Okay. I think this is the